September is Suicide Prevention Month, and today we've decided to take a look at the role of artificial intelligence as it continues to reshape industries and everyday life. Its role in mental health is also drawing attention, from chatbots offering real-time support to predictive tools that can detect early signs of depression or anxiety. AI is certainly opened new possibilities for care and intervention. However, one of the many concerns raised is how people use AI to address their mental health challenges. Let's try and unpack this really complex area of study with clinical psychologist and writer Lesego Lekgothoane, as well as AI specialist Quinton, both of our guests joining us now via our video link. It's great to see you both. Thanks very much indeed for your time and patience. And this is it's a big area of study, so perhaps we should admit that as a start. We're learning about this as we go along. But Quinton, maybe you can take the first bite to the cherry, so to speak. I mean, artificial intelligence, like so many other technological interventions, has come with its pros and cons. And we're speaking about this in the wake of a case where a family is now suing OpenAI because their son actually used ChatGPT to take his own life.
Yes, I do know about that, and I've heard about that. And it's incredibly unfortunate that technologies that are so freely available to children and to families and to individuals without restriction and without restriction being put in place. I think the reality is that as parents, we need to, well, myself and dealing with a very close situation with my own daughter, that something similar happened, is why I took such charge within the AI environment to provide facilities specifically around these sort of things. You know, the unfortunate part is when dealing with AI, you're not dealing with a person, you're not dealing with an individual, right? And it's unfortunate that when individuals, children, get exposed to these sort of tools, these sort of very advanced capability engines that unfortunately, if not checked, if not the right rules and exactly those sort of checks and balances put in place, this is unfortunately what can happen, because you can even get worse cyberbullying, because unfortunately children don't understand that they're not speaking to a person. The AI is driving what it decides and what it understands from its training to do what it wants to do, what it needs to do. And unfortunately, this is what happens in these sort of cases. And it's incredibly scary.
Yeah.
Thankfully, there are tools and platforms that do hold these sort of systems accountable and protect families and protect children. I know this is something that happened with my own daughter. That was something very close, that situation that happened.
Sure, I'm really sorry to hear about that. And, you know, that's the thing, Lesego, isn't it? Most of the people who turn to AI, which we know is a robot, it's a machine, it's a system, actually look for human connections. That's actually why people go there, ironically.
Yeah, it is. I think that it's very interesting because a lot of the time, like you said, people are just looking for a sense of connection. And I think it speaks to the absence of connection in our actual daily lives, where people feel like they have to go the extent of relying on technological advances as opposed to, you know, the people in their lives to feel that connection and sense of belonging. And I think it also speaks to access, right, to mental health care, where in hospitals our waiting lists are very long, you know, helplines are also backed up. And so sometimes people just don't have access to the help that they need. And I think it also speaks to that greater need of things that need to be put in place to give people who are in crisis, especially, access to the services they need in moments of crisis.
Yeah. Artificial intelligence, Quinton, is coming after the advent of social media, and I think many lessons have been learned in how to put in those safeguards on social media platforms, which I imagine can also in some ways be transferred into, you know, tools like OpenAI and ChatGPT, etc.
Absolutely, and it's something that, especially now mental health, like I mentioned, something that is very near and dear to me, that helped my daughter be able to become a lot more confident and stronger person and come out of that sort of depression, is there are direct platforms and services. One that I deal with on a daily basis. I was part of the design and architectural lead team that built the system, housed, and built for the South African market, built for people. And this capability and these sort of services are exactly that. Provide this. So firstly, exactly what we're saying is that it's the human touch, the human feel. And it's by having the capability of families, parents, to be able to provide these tools that are managed securely and provide the checks and balances where the parents are able to monitor in real time the children's Facebook and social media pages, TikTok, Instagram, you name it. But then additionally, because of the power of AI being put into the right perspective, what this very powerful tool then gives.
Oh, what a pity. It looks like we've lost our connection there to Quinton, who is still outlining some of the interventions he's come across. Perhaps I can throw this to you then, Lesego, as we try to reestablish that connection with Quinton, about ways through which you reckon the conversation is inclusive enough. I mean, you mentioned that really part of what's at the core of the issue, at least when people seek the kind of human connection on artificial intelligence platforms or tools, is that actually there just isn't enough of a reach in making sure that, you know, enough mental health care support is provided, especially for people in far-flung areas and, in fact, even in people in the city.
Mm-hmm. I mean, I think, yeah, it does speak to that. And I think that also you find that even in daily lives, just I think beyond seeking help from professionals, I think it is difficult for some people to have conversations with the people in their lives as it relates to mental health. It is something that is still very stigmatized in our society. I think, you know, with social media and people speaking out more about their struggles, it has become normalized to some extent. But I think you still find that in real life interactions, there is still a level of stigma, and there are still a number of people who feel uncomfortable addressing, you know, issues with people in their lives who they find may be struggling. People don't know how to have the conversation. People don't know what questions to ask. People don't know if they're going too far or asking too little. And so I think, yeah, beyond the experts that are in the field that are there to help people, even in our communities, in our spaces with the people we share life with, I think it is still a difficult conversation to have.
So what ought to be the response? I mean, if a loved one comes to me and says, look, I've got these thoughts and I'm not sure if I want to be around anymore, I know it's an incredibly delicate line to thread in just so far as how you respond to that moment.
Mm-hmm. So something that's been helpful for me is actually called the 3 C's. So it is connection, collaboration, and choice. And so with connection, you try to connect with the person. So you don't respond negatively. That would be something like yelling, or in some instances with parents, you know, bringing the whole family together to talk about the thing. I think in that moment, it's important to make the person feel heard and feel safe and feel that you are trying to connect with them and not be judgmental and not push anything that you might be thinking on them, but just really coming from a place of curiosity. So you can even say something like, hey, I'm noticing that you're not quite yourself, or, you know, you've mentioned this thing, you've mentioned these thoughts that you're having. Can you tell me a little bit more so that, you know, I know how to help you? And then the second C would be collaboration, which is involving the person in the problem solving. And so you can ask the person, you know, what is it that you feel you need? What is it that you are struggling with in this particular instance that I can help with? And then choice is ultimately giving the person the choice, giving them a sense of agency. So not making them feel like whatever choice you're giving is forced on them. And I just want to sort of make it a point to say this is not an instance where if someone is of high risk, I would highly recommend getting a professional involved. And if they are in an instance where they've already hurt themselves to an extent, then you might want to call an ambulance or get emergency services, you know, involved. But I think if the person is still expressing those thoughts, then definitely connection, collaboration, and choice. And usually people find themselves in this space because they can't see any other way out of the situation that they're in. So it's often a last resort for them. And I think the key thing is just helping them see that there are alternatives to the problem they may be facing or the crisis they may be facing in that moment.
Such an important discussion. Thanks very much indeed for having us with us. Clinical psychologist and writer Lekgothoane, as well as in his absence, AI specialist Quinton.